Don't think healthcare professionals have any business experience? Think again. No topic is off limits as we share tales from our brave hosts who will always tell it like it is. We are #NoFilterHealthcare. Here to guide you through your healthcare journey are your hosts, Taylor Dunn and Tamara Donda. We want to thank our sponsor, Uptime Health, the leading healthcare equipment and compliance management software company, for bringing this podcast to fruition. Visit uptimehealth.com to learn more. Let's get started.
Welcome to #NoFilterHealthcare. I'm your co-host, Taylor Dunn.
And I'm your other co-host, Tamara Donda. And today we have our guest speaker, Angela Simmons, Partner and Director of Compliance and Content Strategy at Effex.
Love it. Welcome to the podcast. Thanks for joining us, Angela. It's so great to finally have you on here. You've been a partner with Uptime Health for, I believe, since last year already. I can't believe it. So it's great to have you. And I don't know if everyone knows this. Hopefully a lot of people already know, but Uptime Health is also integrated with Effex. So make sure that you check that out and reap all the benefits. But enough with my pitch there. Let's learn more about your background and how you became a part of the Effex team, and tell us a little bit about Effex and the services you guys provide.
So I have my background is dentistry and healthcare. I've worked in that field for the last 25 years. I started off working clinically. I think a lot of people do that. You start in that clinical area, and then as my career progressed, I moved into education. So I taught in the North Carolina Community College system for a decade. I was the department chair for one of their health programs, and I stepped outside of that, went into compliance, and long story short, I opened my own consulting business, was managing compliance for healthcare clients, government contracting clients, and one of the issues that you see in compliance, most especially, and I've talked about this quite a bit with several people over the last couple of days, is we look at how we're sitting here in the 21st century. And we look at how technology has grown by leaps and bounds over the last 25 years. Almost every aspect of our lives involves technology today. And in fact, our kids cannot fathom, especially for somebody like me, they can't fathom that there was this time when cell phones didn't exist, and, smart TVs and YouTube and Siri and Alexa. My grandson is just blown away, right? That how did I survive all of these years? So this technology is, it's grown by leaps and bounds. It's integrated into our lives. And yet, if you go in to any business today and you ask them about compliance, or you ask them about, how are you managing OSHA, or how are you managing HIPAA or information security, you're going to see like bookshelves. Like, it's all paper processes. And so this was one of the things that was really important to me as an educator, as a consultant. How do I not just address compliance for my clients? How do I not just help them achieve those goals and those landmarks, milestones, but how do we automate that as well? How do we make it easier for them to access that data, to make that data more actionable, and then also to produce it when regulators are on site? And I don't have to go find the notebook or the folder or the file cabinet, because we've got it all in one place. So I was looking for that solution when I was out in California last year, and I ran into the guys, the original founding partners for Effex, and I saw what they were doing, and it was serendipity. It was like, this is exactly where I should have been at this exact time. They had a really strong platform framework that they had already created. They were looking at industries like manufacturing and construction. I saw it and I was like, oh, this is healthcare. This is the solution that we need. So, long story short, I've been a partner in the company for the last year, and we've been working really, really hard towards creating content and solutions that will help healthcare entities address every single area of their compliance in one location.
I love it. And, you keep talking about compliance, and I really have this theory that everyone secretly knows how important compliance is, but they're genuinely afraid of it. So even saying the word compliance can just scare people off sometimes. So I'm just curious, how does your company combat this fear of healthcare facilities not being compliant? So give us that, hashtag no filter answer. So by the end of this episode, I want people feeling like they're not alone. There is a simple solution to improving healthcare compliance.
So, man, you hit the nail on the head. There's so much fear, right, that is instilled around just that word compliance and what happens. And there's almost this element of, for some entities, that like if I pretend like I don't know, then maybe it won't be as bad. And so, it won't be as bad as if I'm just non-compliant. I knew, but I'm not compliant. And so I always tell my clients, number one, not doing anything is just as bad as, or saying I didn't know is just as bad as, I did know and I didn't do it, because there's not really a reason that we shouldn't at this point. But the next the next aspect of it is that when you engage with a company like Effex, or you engage with a company like Uptime, you're engaging with a partner in that compliance world, and we're here to support you. We are the sounding board. We're the people that you come to and say, what about X? What if I did this or I didn't do this? What does this look like? We're the people that can, come in. I spend a lot of time doing risk assessments and facility audits. And I'm that person you can tell, like, maybe I'm not, you said I'm supposed to be doing this, but maybe I'm not. So what happens if I'm not doing this? And so I think that's, the first thing. Align yourself with somebody who really understands compliance and is on your side. You want that person before the regulator shows up. Because I go in and I'm going to look at your practice the same way a regulator does, but I'm on your side. And so that is my whole job. I'm going to be, critical when I look through the practice, because it's my job to find little things that might not be what they should be if a regulator were on site, but that's my role, right? Find those problems before you have the bad outcome. And I would say beyond that, that OSHA's still going to show up at your practice. You may still have that outcome where OCR has contacted you because there's a HIPAA problem. And again, it just goes back to, why do you have people like Effex, or why do you have people like Uptime? Because when those regulators show up, we can help you walk through those processes, right? We can help you with responding and gathering the appropriate responses and data that you need to make sure you have that really good outcome at the end of it.
Yeah, that totally makes sense. And it's interesting that people don't instantly understand that concept, right? And that you kind of have to show them, and it's good to be on their side, right? And fix the problem before it becomes a problem, right? A costly problem. So as we all know, I feel like one of the biggest topics right now is talking about turnover. So how do you ensure that your compliance and everything that you're educating these offices stays in place if somebody were to leave?
So before, and I can definitely, I can speak to this from just personal experience. So I've worked in, education and compliance for the last 20 years. And up to this point, up to having, joining Effex as a partner and working on this compliance management platform, the processes have all been manual. And so I have seen over and over again when, I've got a client and their safety officer leaves, the manager leaves, and somebody new comes in, and then nothing will happen for a little while. And 3 months in, 6 months in, I'll get this phone call and they'll say, hey, Angela, like so-and-so's here, OSHA's here, or we need this, we need that. And we have no idea what to do because this person left. So one of the pitfalls is because all of these processes were so manual that you had to know where the notebook was. You had to know what was sitting up in that person's brain. When you've got a SaaS solution, right, a software solution, now it's all in one place. And so we have one thing that we have to tell that person instead of 20, right? Here's where the OSHA is, here's where the SDS is, oh, here's where the HIPAA is, and infection controls over there. Now we can say, here's the compliance management platform, and this is where everything happens at. All of our policies are there. All of our SDS is there. This is where we manage our equipment. This is where we get somebody, we go out and get a tech to come in and repair our equipment. This is where we manage tasks and audits and inspections. So I think that, like, technology is the answer. And I've thought about it so much in the last couple of weeks or so, and I know I said it just a few minutes ago, but it really is. We use technology in every other aspect of our lives, but businesses are still that backside of business compliance and business management processes is still so manual. And Uptime had a social media post about Excel sheets, and I've seen that I've seen that before. And in fact, I did a presentation with somebody, and we were talking about, Excel sheets have mistakes, right? 88% of Excel sheets contain errors, but we still use them to manage processes. When you start automating that, you start using technology to help automate your processes and your daily requirements, you can greatly reduce those errors. It's going to reduce your risk. It's going to increase compliance. And obviously, when you have turnover, which is kind of big in healthcare, then you can reduce some of those pain points as well with onboarding that new person.
Yeah, and one of the things as far as Excel that we always talk about is the fact that people forget to input the data even.
That's right.
So it's a lot of human error as well. So having the technology on your side can really help you in the long run. So when you start working within a healthcare facility, what are the top 3 compliance mistakes that you see right away and you're like, okay, I got to fix this?
I think training is probably really high on that list. I go in and there's a lack of understanding sometimes of what I really need to train on. So not knowing what I need to train on, not having the training in place. So that's one thing that I always try to accomplish really quickly is let's start getting some of this training done and make sure that we can definitely attest to. If any regulator that comes into your practice, they're going to be looking for training records, right? Content of your training and the training records itself. And I think that's something that's important. Content matters. You can't just send employees out to YouTube and say, hey, watch X video. You can't just buy like a CD or a DVD and say, let's watch this video, because who's the expert? Who's answering the questions for those employees that might come out and that should come out of that training session? So training is really big. Policy and procedure is another really big issue. There's no carve out that allows an entity to buy boilerplate policies and say, this is my policy. The issues that exist with boilerplate policies are that they don't necessarily match your operations, and they have to. If your policy says you're doing it, you have to be doing that. And we see that over and over again in when there's a bad outcome. That is true of OSHA. It is extremely true in the HIPAA world, the Health Insurance Portability and Accountability Act. You've got to have policies and procedures that are specific to your practice and that are being followed, that are being used in the practice. So training, policy and procedure, and beyond that, I would say employee understanding and employee compliance, I guess, with some of those regulations, with some of those rules. So I always, when I go into a practice, I do a risk assessment, and part of that is evaluating employee behavior. And that's just simply by observing, right? I can walk around a practice, and while I look at all of the different areas of rule that could be impacted, in the practice, looking at sterilization, looking at their lab, looking at, the drugs that they're using and expiration dates and things like that. But I also look at employee behavior, because that makes a big difference. If OSHA walks into your practice in the middle of a pandemic and your employees are not wearing personal protective equipment, I mean, it's a bad day. I had an opportunity to just recently, within the last 6 months, I was in a dental practice in another state, and I walked in and I was terribly shocked that the employees were not wearing personal protective equipment. Some of them were wearing masks chairside, some of them were not. Some of them were wearing jackets, some were not. Some were wearing safety glasses, some were not. They had food and drink in the sterilization room. And, those things, I'm an educator and a compliance person, so I don't want you to do that. But the reality was that I know there's a lot of pandemic and COVID fatigue, but if there's one good thing for me as a compliance person that came out of this pandemic, was it shone this really bright light on what we should be doing to protect employees in every single industry. And healthcare, we've always had these protective measures and mandates in place, but we don't always enforce it like we should. And somebody's got to do that within a practice and say, hey, here's the rules, and this is really about protecting you. It's not to be punitive, it's not to make your life difficult, but this is about protecting you. I want you to come to work, and I want you to come in healthy, and I want you to leave healthy. I don't want you to go home and you're sick, or you've got a debilitating disease now. So it's about keeping them safe. And so I think that's probably that third element, is employees not really understanding what those rules are, how those rules apply to them, and how they need to interact within those rules.
Yeah, and better patient care as well, right? You're protecting the
absolutely.
Patient, and they're the ones to write the review. So
yeah, patients definitely, I think at this point, and that's, that is something that I always talk about in training with my clients, is that the things that we do when our patients are there, and even those things that relate very specifically to safety of our employees, because OSHA is only about employees. OSHA does not care about your patients. Somebody else does, but OSHA does not. They are about employee safety. And so even though it may be about employee safety, when the patient sees us doing the right things, wearing our personal protective equipment, performing hand hygiene, the patient may not understand all of the technical terms, all of the legal terms, but they understand we're doing something right. And when they leave our practice, they're going to talk about us, and it's going to be positive or it's going to be negative. And I think we have a lot of control in that by doing the right things in front of the patients. And when they're not there, when they leave, they're going to go and they're going to tell people that, you know what, I was in X practice today, and man, they do all the right things to keep you safe. I feel really, comfortable there. I feel like I'm safe there. You should go there too.
Essentially, compliance, even though people might be a little intimidated by it, but when you have it in place and you're doing everything you need to, the patients notice, and then they do the marketing for you. Yeah. And that's what sets you apart from the person down the road, and elevates your practice completely. And I think you've really touched on some of the very big compliance issues that you see in every industry. I come from accreditation in urgent care, and I have to say, I definitely agree with you. There were so many times that people just wanted to purchase policy and procedure manuals that were templated, and that's great because, they are burdensome, and I totally understand wanting to just be able to take what someone's already done. Let's not reinvent the wheel here. But at the same time, you still have to go through them. You still have to identify what's going to work for your facility, edit them down, make sure that they're right for you guys to be able to truly implement. There were so many times we've we'd do a survey and it'd be like ABC urgent care. And we're like, that's not the name of your clinic.
That's right.
Hey, but stress no further because Effex is here to save the day.
Yeah, that's right. Exactly.
That's what we would like to do. I mean, this is really, I think, if I could, and one of the things I always try to instill with my clients, and if I needed to send a message out to those potential clients today, it really is that when you hire somebody like Effex, you hire somebody like Uptime, you're hiring a partner, right? We're there to help you. No matter what I see in a practice, no matter what we discuss in a practice, all of that's between me and the practice. I don't go call OSHA. I don't go call OCR. I don't go call your state board because my job is to help that client achieve the highest level of compliance, safety that they possibly can. And my job is to consult with them. My job is to offer them recommendations and ways to improve where it's needed. So we're the partner. That's what we want to be, a partner in compliance. We want to focus on those issues that are difficult, that are scary, that nobody likes to deal with, because we want to make sure that those dental clients and those medical clients can focus on their patients. That's why they went to school. They didn't go to school to, worry about OSHA and worry about HIPAA. They want to worry about patients. And so that's the aspect that we want to take on.
Yeah, this is, I think, eye-opening for some, and then others are like, you know what, I can completely relate and I need this and it just makes sense. And I'm hoping that there's a lot of people also that are like, I've got this. I've been doing this stuff. And, that's what we want, is we just want to make a better experience for all the patients and, improve everyone's business and quality of care. So it was really great to have you today, Angela. Compliance, as we said, is always a hard topic to discuss, but we appreciate having an expert like you provide some guidance and pointers to our listeners who may be experiencing some of these challenges in their offices today. So if you'd like to learn more about Effex, make sure you visit effex.cloud, and please subscribe to our podcast or comment below if you have any questions for us. Thanks, Angela.
All right. Thanks, Taylor. Thanks, Tamara.